Thank you. Thank you for inviting us to present this qualitative study, which is part of the main OPAL trial, which was funded by the NIHR. I have no affiliations to disclose. As Sarah has already explained, the OPAL trial was a test of the clinical effectiveness of biofeedback plus pelvic floor muscle training against pelvic floor muscle training alone. This qualitative case study aimed to explore women's experiences of the two different interventions and also to help us explain the contextual factors that may influence intervention adherence and outcome within the randomised control trial design. So our design was a two-tailed, qualitative, longitudinal case study, which ran in parallel to the main trial. Data were collected by longitudinal semi-structured interviews at the same time intervals as the data was collected during the trial. The sample were a subsample of the main trial group, and for the qualitative study we had 20 women who had received biofeedback plus pelvic floor muscle training and 20 women who had pelvic floor muscle training alone. The sample characteristics in the qualitative study were proportionally similar to those in the main trial, and these results focus on those from 24 women where we had data at all 4 interview points. So to move on to the findings. The results focus on aspects that influence women's interaction with the interventions in each group. So if we look at context first, there were many facilitators to adherence, and these were 2 key facilitators for women. The first was the desire to improve or prevent the deterioration of their UI symptoms. And secondly, the women were very positive about the teaching that they received from the treating therapist, and they spoke about that in ways that linked the therapist to the knowledge and skills that they had gained and hence the exercise that they undertook over a period of time. There were also many barriers to facilitators. 2 of those key examples centred on the fact that women felt they had limited time in their lives and that their lives were generally very busy and it was difficult at times to fit exercise in. In terms of adherence was influenced by the many contextual factors that were raised by women. Adherence varied considerably for individual women and also over time, in that it waxed and waned over time. The patterns of adherence were very similar between the 2 groups, and perhaps an important thing for the clinicians in the room were that most commonly women felt they had maintained their self-efficacy or their confidence in their own ability to restart exercise after a break, after their period of formal exercise training was finished. As we've heard, Suzanne will present the main trial results tomorrow. What we were trying to do in the qualitative study was understand women's experiences of their outcomes. What I hope this table can show you is that there was a variety of outcomes described by women, and that there were no obvious group differences in those outcomes. So in conclusion, the context within which women lived their lives influenced their adherence to exercise regardless of their allocated group. There were no obvious group differences in context, adherence or outcome. And women worked hard to create a balance between their busy lives, their desire to be rid of their UI symptoms, and the value they placed on what they'd learned from the therapy sessions. From that, we've taken a clinical message to ask for consideration of that complexity, or to continue consideration of that complexity, along with specific attention on problem solving and action planning for relapse management, particularly within the context of the busyness within which women live their day-to-day lives. Thank you.
Thank you. So, feel free to ask some questions. Actually, in the meantime then, I'm a bit curious about these. You have these women who didn't have an improvement or worsening symptoms. Was that also age-related? So they were older and having a problem because of not having tested before, earlier?
We didn't, the case study obviously as well, it's a huge sample for a case study, but the numbers in terms are relatively small. So we didn't notice any particular age effects, and the outcomes I put up there were at 24 months, which is the primary outcome measurement of the trial. We could also see differences in outcome, so women's outcomes. We could see patterns that they got better through the first 6 months or that 16 weeks of treatment, and then sort of a steady, either a maintenance or a slight decline.
And what happened to them if they got really worse? What do they do then?
In some instances, the women chose to do nothing. In some instances, the women felt they still had the skills to relapse manage, so to start again the exercise should they choose to.
Okay. Some more questions?
Thank you, Carol. Given the importance of adherence and strategies for relapse management, did you build in any of those strategies into the protocol?
Yes, yeah. So there were a huge, I think the slides Sarah put up with all the checklist on it, they were all behaviour change techniques. So there was lots of strategies in there about adherence, you know, goal setting being one example, you know, the signatures, yeah. So yes, there were many, is the short answer to that.
Okay.
Okay.
Thank you so much.
Thank you.
Very good.